Hey everyone, my name's Lindsay, and I did my capstone project on drug addiction. Some of my main objectives were to identify an individualized family theory, obtain a information prescription for the population, present community resources available, provide an accurate description of the population, identify the roles and responsibilities of advanced practice nurses, accurately describe the population vulnerability, and present the political and social issues. Family description. So I chose to talk about a 26-year-old male who was addicted to prescription pain meds and heroin. He lived with his girlfriend, who also was addicted to drugs. He has a very supportive family and had a great childhood. Grew up very normal, I guess you could say, and was the first one of his family to become addicted to drugs. Once the family found out about his drug addiction, the patient was forced to move back home. His parents had to move back in, get away from his girlfriend, and they helped enroll him into counseling and different programs to help him overcome this addiction. So family theory. Family theory refers to a theory that encompasses health and how that affects the family dynamic. And then in this instance, the patient's health affects the family because they never thought this drug addiction would happen to them. The family was in denial at first, but later they opened up to find help for the patient. My information prescription for this patient, I provided numerous websites for a reference for him. The first one, this is so that the family can learn about addiction, what it looks like, symptoms, causes, treatments, and then the fact that maybe this can help them wrap their heads around what exactly the patient is going through. That was one of the main things for this project. The patient's family just really couldn't understand how could he do this to them? How can he be doing this and being addicted to drugs, because that doesn't happen in their family. So I wanted them to kind of just learn more about what addiction is. The second website, this is for an actual drug rehabilitation center in Erie, PA. They help with relapses and offer counseling for the patients and the family. It can help everyone cope with the situation and discuss the issues they might not feel comfortable talking about at home. Again, when I talked to the family, the mom said a lot of times it was uncomfortable when I would try to ask them these questions, but I really wanted to know. So I figured maybe a reference like this would help if they want to talk in an environment that's prompted by a professional. On the last website I put on here because it trends the statistics of drug abuse in certain areas of the country. I brought this up so that the family can feel as though they're not alone, and it brings attention that this is happening, unfortunately, a lot more than we want to believe. And it showed the family that, that they're not alone and that this isn't only happening to just them. So community resources, the Erie community actually has multiple resources for this population. So I just chose like the three pretty well-known resources for this case. So Narcotics Anonymous, these people have to go make the commitment that they are done using drugs, they are done with this behavior, and that they are trying to better themselves. I added Narcotics Anonymous Al-Anon because once again, I focus really primarily on the family also, and they just needed somewhere to go where they could connect with others and know that they're not alone, hear other experiences, relate to other people. Maybe they can get ideas of how some people coped with the situation, rather how they are. And then I put Stairways Behavioral Health. This is a place that offers multiple things, but one is including is the Gage House, and that informant interview. I was able to talk to the clinical supervisor of the Gage House. She informed me that there's long-term, short-term. The patients, it's an inpatient program. They go and go through rehab there. And the great thing about this program is the patients are also kind of integrated back into the community. I was able to ask her, like, after they're done with this treatment, are they then just kind of kicked out to the curb, or what's the next step from there? And she said they are linked up to multiple other resources in the community that are there to help integrate them back into society, help them find a job, and try to prevent them from going back to their old ways and back to their addiction. Pretty much, the people that they are surrounded by play a key role in whether or not there's going to be a relapse. So population description. I thought there was no better way to describe a population than having the CDC's reference. So the CDC describes drug addiction in numerous ways, but then they also provided some pretty startling facts on their website, and I just figured I'd share it with everybody because it does kind of describe, how addiction, especially heroin, is taking over our country, just sweeping through. So heroin is used more than doubled among young adults ages 18 to 25 in the past decade, which is startling because you don't want to believe that, but young kids, it's getting younger and younger that they're getting sucked into addiction, drug abuse. More than 9 out of 10 people who use heroin also used other drugs, which makes sense. A lot of times everyone uses, like, as you would call, the gateway drugs before they go to heroin. 45% of people who used heroin also were addicted to prescription opioid painkillers. And that's exactly what's true in my case. My patient actually went to surgery when he was just about her sophomore year of college. He got surgery, and then the painkillers that they gave him after, he became addicted to them. And from there, he engaged in more risky behavior, and he then soon got surrounded by the wrong crowd. And as a result of that, he experimented with all sorts of different drugs, including heroin, and became addicted to both the painkillers and the heroin. So what does healthy people, 2020s, what do they think about it? What's their interpretation? They listed that substance abuse contributes to cardiovascular conditions, pregnancy complications, STDs and HIV, domestic violence, and child abuse. I know a lot of these seem like, well, yeah, anything can really lead to that, but when you think about it, I never thought that drug abuse would really lead to, that crazy of cardiovascular conditions. But one of their quotes stated, "The use of cocaine, ecstasy, amphetamines, and steroids have been linked to abnormal cardiovascular functioning, ranging from abnormal heart rate to heart attacks." So it's not only affecting just their social life and everything like that, but their health conditions are also being affected by drug abuse. And it's actually pretty shocking that this is happening. So the nursing knowledge and skills. A very important part of caring for patients with a drug addiction is remembering that this is a mental health disorder. We must establish trust between the nurse and the patient, like always, and keep a non-threatening atmosphere. You don't want the patient to think you're judging them just because they have a drug addiction. And never say, "I understand," because if we have not been addicted to drugs, then we do not understand what the individual is going through. I think that's kind of the cardinal rule for nursing to begin with. It kind of creates a barrier between you and your patient by stating that you understand when you've never gone through something like that, and they know it. So I did my advanced practice nursing on nurse anesthetist, and surprisingly, it does play a role in drug addiction because, for example, if an addict needs surgery, The anesthetists will need to know how to regulate the drug they'll be giving. They need to know how the individual will respond to that. And I think most importantly, they need to keep in mind that the individual has a tolerance to drugs. So they need to ensure that the patient stays asleep through the entire surgery, because just like any other patient, you wouldn't want them to have to feel the pain of surgery or anything like that. The ethical and legal aspects. So ethically, the public seems to judge these individuals, and at times they get written off as helpless. We need to change that mindset. Yeah, they are doing something different, they are doing something that's illegal, but you also have to remember that we're not in the day and age anymore where mental health disorders are viewed as taboo. So I think it's important that we change that view of this population. Legally, I mean, these drugs are obviously illegal. So as far as the legal system goes, a lot of the addicts are afraid to get help because they don't want to get in trouble by the law. So they normally just stay in their habit because that's the last thing they want to happen is to go to jail. This is a vulnerable, very, very vulnerable population. For the following reasons. It's a mental health disorder. I feel like any mental health disorder is very vulnerable. This is obviously, again, illegal. So there's tons of risks involved with drug abuse, with being involved in any type of drug action or, I guess, relationship. These patients are mentally unstable while on drugs. It can be hard to approach them if you're a family member and you know what's going on and you really want to get them help. If they're high on drugs, sometimes they just seem unapproachable. And they're vulnerable also because they feel like they're alone. They feel as though they're trapped. They want to get help, but they don't know how. They don't want to get in trouble. They don't want to seem judged. They don't want to lose their family. There's tons of things that make this population extremely vulnerable. Politics or political and social issues. For the first very important fact is the cost of treatments. A lot of time, treatment is too expensive to enroll in, so they don't go get the help they need. I was able to have the experience of going into a detox center at Mill Creek Hospital, and I was able to talk to a lot of addicts, and they told me, they'll see the commercials on TV for the Malibu Rehabilitation Center, and when they said they looked into it, it was just thousands of dollars that they didn't have. So they're like, well, I can't find help anywhere. I don't want to go somewhere, if they didn't want to go somewhere in the community because they didn't want people to know, they just felt pretty helpless, and like they didn't really have that much of a choice of, whether or not to get help. And then the social issues, the way the public views addicts, it's kind of sad, and so instead of getting help, they're too embarrassed. Just like I said about the people in the detox center, they're too embarrassed, and a lot of time the family and friends don't understand that it's an actual addiction. They just say, why can't you stop? Why can't you just, not do it? We just have, as a public, need to realize that they just can't simply stop. So my take-home message, we need to change the stigma that is placed on addicts. As nurses, we can play a key role in advocating for this population. We must always remember that everyone is human and makes mistakes, and yes, it does take a person to put the needle in their arm, but it also is the drug and the addiction and the mental health disorder that is driving them. It is essential to treat every patient equal, no matter what their story is. So I really think that we could all join together as nurses, and even if you get a patient that is addicted to any type of drug, I know we've all probably had one, think of it from a different point of view. Think of, maybe I can give them a resource that they could go to, or I could help them in some way that they haven't received yet. So, references. Thanks for listening, guys.